name is Kate Harold. My title is Strategic Initiatives Coordinator. I sit in the medical division in public health, and a big part of my portfolio is coordinating and leading work as part of our departmental health equity strategic plan. One of the projects that we've just officially launched is called the Niagara Priority Profiles. So I'll walk through what they are, kind of why they were created and how they might be used, and then there'll be an opportunity for any questions that anyone may have. So as I mentioned, my role kind of leads work as part of our health equity strategic plan. It was created in 2018. It's available on our external webpage, but there's essentially 4 streams of work. A lot focused internally of how to integrate health equity into our programs and services. But also there's an element of collaboration there of working better with in a more coordinated way with community partners. And so one thing outlined as a milestone in our health equity strategic plan was to have health equity data more readily available, both internally and externally. And so the Niagara Priority Profiles was a way to achieve that. So what are the profiles? So we created this data product, we're calling it, of 11 profiles of priority populations, and we collated data available on those populations. So we've got data at different levels. We have census, national level data, we have some provincial data sources and some regional data sources. And we've heard from community partners over and over that having that data on specific populations available in one place would really help. So this was a way to kind of provide that. They're available on our external webpage. And we modeled the profiles off of a Ministry of Health tool. So the Ministry of Health created something called the Health Equity Impact Assessment years ago, about 15 years ago now, and kind of to support kind of the process of identifying inequities in programs and services, they created or kind of categorized populations into certain groups after consultation with community members, of course. And so you can see them there on the side. So we have 11 profiles of available data created. So there's an age profile, a profile on disabilities, education, ethno-racial and immigration, homelessness, Indigenous, linguistic communities, low income, religion, rural and urban, and sex and gender. I'll just highlight that our Indigenous profile, we took a very unique and tailored approach to. We actually engaged with some urban Indigenous organization leaders to have a review of it before we shared it publicly. And that one, if you have a chance to go through them, is we take a different approach. We talk a lot about the historical context of Indigenous communities in relation to data collection and sharing and kind of the concept of Indigenous data governance. So that one's a little bit unique to the others, but yeah, so that's what the profiles are. I included a couple snapshots of what one might look like. So all of them have this front page there that's up on the screen that kind of gives an introduction of the importance of the social determinants of health, and that there's also the idea of intersectionality to consider, and that each profile is meant to be kind of a snapshot of that population in Niagara, but in no way should be applied to like the individual level. And there's also the importance of intersectionality in terms of somebody experiencing, homelessness may intersect with also low income, and kind of that is considered across the profiles. So as an example, I pulled the ethno-racial immigration profile. So here's an example of data that's available. So for this one, we include census data of visible minorities in Niagara. And we compare it from 2016 to 2021. So that's the census year cycle. Depending on the profile, we either compared kind of year over year, or we compared Niagara to Ontario, kind of whatever told a better story that would be more impactful for our staff and our community partners to use in program planning. So it's an interesting snapshot because you can see that there's been an increase in visible minorities across the categories that census provides. Which is hopefully an indicator of a more diverse population in Niagara. And another part of this profile includes the percentage of maximum capacity for temporary foreign workers, also kind of known as international agricultural workers. And it includes some numbers that there's about 4,000 workers in Niagara at any given time, and then it gives some of the municipalities that have the higher percentage of them. So Niagara-on-the-Lake, Lincoln, and St. Catharines come up as the top 3. So that's an example of what would be in these profiles, very heavily focused on quantitative data available. And we also link some social outcomes that may be disproportionately experienced across populations. So why were they created? I already sort of mentioned that. It was outlined in our health equity strategic plan to support program planning, both internally and externally. It was an ask from community partners to have this data more readily available. It aligns with the Ministry of Health's Health Equity Impact Assessment tool and the populations that they identified as priority populations. And it just provides some additional information on priority populations to hopefully inform work and make things more equitable. In terms of how to use them, so we launched this officially externally 2 weeks ago. So an email went out to a list of community partners, including executive directors of family health teams and community health centers. And along with it, we created a 1-page guiding document of some key considerations of when you're looking at the tool, at the data products, and also some things to help guide how you might use them. So some things we came up with was informing the development of programming, helping identify who is a priority in relation to your program. It also provides an opportunity to support grant and funding applications, and it's a way to complement consultation efforts with the populations identified. So some of the considerations I mentioned, which are in the external guiding document, which I'm sure Rachel, maybe we could share that after as well, along with the link to the external page where the profiles are housed. One thing we're stressing to staff when we rolled this out was that the profiles are just one source of data that can be used in decision making. So there's multiple kind of other ways to inform work. So this is just one piece of the pie. And they don't replace consultation with priority populations, but rather complement any collaborative efforts. And I had mentioned as well, they're population level data, so not meant to be representative of individuals. So yeah, so I think that's the snapshot of the profiles. I think we had, our next question was how this might be applied in a primary care setting, but prior to that, if anybody has any questions, I'd be happy to answer them.